going to address some common myths today about incontinence and what can prevent some women from seeking treatment for an issue that has become very treatable. So a lot of women say, well, I'm used to wearing pads, I'm managing it to some degree, why should I have something done? And what I tell my patients is, if it is not keeping you from doing things you enjoy, if it's not keeping you from your normal activities, if it's not getting in the way of things you love, by all means, conservative management, just watching you and seeing that it doesn't get worse is perfectly appropriate. But if it is keeping you from going out with your friends, if it's making you worried when you're out in public places, if the cost of pads is getting exorbitant, then coming in for an evaluation is a good idea. So the next thing a lot of my patients ask me is they're concerned that if they do want treatment for their incontinence, they're going to have a procedure done. And what a lot of women don't realize is that our approach to incontinence has gotten much better over the years, and there's a lot of things that we can do to get you markedly more dry simply in the office. So what I tell my women is just to come in for an evaluation. We have a lot of tools available as clinicians to see what specific factors are causing your incontinence and how we can best treat you to get you, if not 100% dry, at least dry enough that you're happy and hopefully pad-free. So what I tell my women is there's a lot of things we can do in the office now. Before, for example, for stress incontinence, when you leak, when you cough or sneeze, it was surgical options only. Now we have great options such as pelvic floor physical therapy, and we have wonderful physical therapists at West Dallas. They are nationally recognized, and they honestly are the ones who train a lot of the physical therapists elsewhere in the nation and our community. They do wonders with my patients, and with simple intervention and exercises alone, they get them markedly drier. For stress incontinence, we also now can do in-office injections into the urethra to make the urethra a little more closed so urine doesn't leak out as much. It takes about 20 minutes. There's minimal discomfort. It's about as uncomfortable as getting your blood drawn, and you can go back to your normal activity the same day. For the type of incontinence where you feel like you need to run to the washroom, most women don't realize that incontinence can be treated easily with medication. There are a lot of good medications on the market, and we can usually find one with minimal side effects and good efficacy for your problem and get you significantly drier. So the best thing to do if incontinence is affecting your life is to come in for an evaluation. Then we can honestly sit down with you and tell you what your options are, how much improvement you could expect, and then you can decide what type of intervention suits your lifestyle.